So the VIRTUS trial is an IDE trial analyzing safety and efficacy of the Vici stent, one of the dedicated venous stents for recanalization of venous outflow obstruction. So there were 170 patients included in the VIRTUS trial, post-thrombotic patients with compression syndromes, where in these centers where they participated in this trial treated these patients with the Vici stent. So the unique thing of that trial was that these patients had a close follow-up using venography and IVUS. So meaning that you could learn a lot during follow-up about the behavior of that 90-node dedicated venous stent through follow-up using venography and IVUS. In terms of efficacy, they found a very good patency rate, primary patency rate, and also very low target lesion revascularization rate. So this stent proved safety and efficacy for patients with post-thrombotic syndrome and compression syndromes. So there are a lot of patients, especially suffering post-thrombotic syndrome after iliofemoral DVT or suffering from May-Thurner syndrome. During the last years and probably during the last 1-2 decades, awareness rised for these patients to give them hope for their symptoms. They are suffering from persistent swelling, venous claudication, and very low quality of life. What we learned is during the last years that dedicated venous stents should be used, not arterial stents, to recanalize these outflow obstructions. And there are now a couple of dedicated venous stents on the market. Of course, we want to have good data for all these stents. And the Vici stent is one of these options, and the VIRTUS trial proved efficacy and safety for the stent.